Hello, everyone, and welcome to the panel discussion exploring nutrition equity within South Florida, presented by Common Threads. We're so pleased to have our panelists here today, along with attendees from all over the country. I'm Jordan Fickus with Common Threads, a national nonprofit that was founded in Chicago and provides cooking and nutrition education to children and families with a focus on cultural diversity. We've been here in Miami now for more than 10 years. Before we get started, I will cover just a few quick housekeeping items. Most viewers will probably prefer to use speaker views so that you can see the panelist who is currently speaking. You can access this by clicking the speaker view icon in the upper right-hand corner of your Zoom screen. Our Zoom is set up so that all participants are muted and screens are turned off except for our panelists. And today's session is being recorded, and it will also be streamed on our Facebook page, where it will be live for people to view on demand, and we'll also send it out afterwards. Finally, we'll be taking questions for the panelists. If you do have a question, please feel free to submit it in the Q&A window or in the chat. And I'd now like to introduce our co-founder and CEO of Common Threads, Ms. Linda Novick O'Keefe. Linda, you're in mute.
Oh my God, it's like so embarrassing. Anyways, hello everyone. It's a pleasure to have you all here with us today. Today's discussion promises to be very informative. We have all learned so much over the past year and a half as the result of the COVID-19 pandemic. Today, we're going to dig deep on the specific challenges and systemic solutions impacting hunger and nutrition equity within the South Florida community. And we have some very smart and committed public servants here today to guide the conversation. November will be the third or potentially the fourth month in some states that since school doors have been open to millions of students across the country. In addition to academics, the return to school has meant consistent and nutritious meals for many students to allow them to regain a sense of community that was lost during the peak of the pandemic. To get us started, we're going to speak with two outstanding principals and partners of ours from Miami-Dade County Public Schools about how COVID has changed education in pivotal ways. I want to first introduce Yolanda Ellis of Arcola Lake Elementary School in Liberty City. Common Threads was introduced to Miss Ellis when she was principal at Frederick Douglass Elementary in Miami's Overtown community. Throughout her career, she has collaborated with so many community-based organizations to bring more resources to our students and families. Miss Ellis also recently transitioned to a new school. Welcome, Miss Ellis.
Good morning, everyone.
So good to see you. We're also very pleased to welcome Milagros Maitin Murray, the outgoing principal of W.J. Bryan Elementary School, which was Common Thread's very first partner back in 2009. Today, we'd like to acknowledge Miss Murray for her many decades of service to children and families, as she will be retiring in just a few weeks. I am pleased to share that we have a very special guest this afternoon, Mr. Rudy LaFrance, who is an alumnus of W.J. Bryan Elementary. He is joining us today to help honor her. When Common Threads opened its doors and had our very first class in Miami, Rudy was actually one of the students in that very first class. You can see him here on the right side of the picture. Today, Rudy is following his passion for music and pursuing his bachelor's degree in commercial music technology at Florida Atlantic University and traveling to different cities and states to play guitar at a variety of gigs. Rudy, we are so glad you could be here today, and we'd love you to share a few words.
Thank you so much. It's a pleasure to be here. So hey everybody. So as an alumni of W.J. Bryan, it's my pleasure to recognize Ms. Maitin Murray as she heads into retirement from MDCPS in December. And I remember Ms. Maitin Murray from my time as a student. Of course, I especially remember how it was her mission to just make the students happy. That's pretty much her mission. My best memory of her, I think, one time she was in a dunk tank and somebody hit the target and she went down. Yeah, she's laughing now. Yes, yeah, she remembers. Yeah, but that's my best memory of her, and that I'm sure many students thought, wow, this principal, she's a cool principal, and of course because of Miss Martine Moret, that students at WJ Bryan was able to, including myself, was able to participate, in a program like Common Threads, and of course, I'm just grateful for all those, that opportunity as a
I'm
young
so
child.
proud
Yeah,
of you. I'm so glad that you're doing so well.
thank you so much, Miss Martine Moret.
Oh, you're welcome to come visit whenever you want.
Right, true. So
Thank you, Rudy. It's really meaningful to have you here with us today. A full circle moment.
definitely.
So I'm going to transition to our very first piece of the panel. To you wonderful principals, my first question is, what changes have you observed in the returning students, their well-being and overall health from the past year and a half? Miss Ellis, do you want to start?
Okay, yeah. Well, yes, I'll start. Physically, I can't honestly say that I've seen much change physically, but many of our kids are struggling socially and mentally. I would say being isolated and not, physically in the building, not being around other children. So it's been a challenge with them returning, learning how to socialize again, learning how to get along with their peers and interact with other adults outside of their family, circle. So, again, other than that, physically, hey, they are just as rambunctious as, they were prior to our dismissal in 2019. But definitely, 2020, I'm sorry. But definitely there is that mental piece is super, super important right now.
Yes, I agree with Ms. Ellis. The social emotional aspect of it has been a difficult transition, especially for those students that didn't opt to come back face to face last school year and they stayed online for the entire school year. It's been a difficult transition back for them. What I have noticed with a lot of our students that didn't transition back last year is that many of them did put on some weight. Well, some of the adults also put on some pandemic weight, but it's to be expected. They were at home, not as physical, not participating in after school activities or maybe sports or different things. So, and traditionally our schools have a high Title I percentage. And a lot of times in high Title I percentage schools, parents may not have the extra funds available to be able to buy those nutritious foods such as vegetables and fruits and things of that nature. So they have more of a high fat diet at home. So I did see some of our kids that put on a little bit of weight.
Thank you both. You just mentioned it, but both of you do lead schools with high participation rates for free and reduced school lunch. When it comes to addressing food security and nutrition equity, can you talk a little bit about the resources that have been most impactful for students and their families at your schools?
So during the full and partial shutdown, the district provided meals to our families. And those meals were very essential for many of our families. I know at our school, I had a core group of families that were really dependent on those meals. And they were very, very appreciative on being able to, feed their families when many of them were, out of work or laid off, and just the resources weren't there. I also was fortunate enough to have one of my partners, Embrace Girls, a program that I have here at my school. They also provided hot meals from some of the local businesses would provide hot meals on certain days of the week. And we had quite a few families to take advantage of that as well. So there was definitely a need during this time.
I agree completely. We had about 50 to 100 families that would come every 2 weeks. I'm sorry, twice a week to come and pick up food. Then they cut it back to once a week. But they would make their line in their cars. We'd put the food in the trunk of their cars and they'd go on about their business. But many of those families depended upon the food the Miami-Dade County Food and Nutrition Department provided for them in order to feed the kids through the course of the week. We had many of our parents that were not working. They were at home, no income, and still bills coming in. So this food that was provided for them really helped. We also had a couple of events with Common Threads that they set us up with the Feeding South Florida and other entities to be able to provide our parents with those healthy things like fresh fruits, fresh vegetables.
Yeah, that was awesome.
Yeah, that was fantastic.
Yes, yes.
Because many of the foods that Miami-Dade County Food and Nutrition were shelf stable or frozen foods or canned foods. Being able to introduce to them fresh fruits and vegetables and things of that nature was
And who's Judy Gonzalez?
Go ahead.
No, as I was saying, those fresh fruits and vegetables were a treat to those families. And in fact, they would come up and they're like, oh, yay, fresh fruits, fresh vegetables. So it was a treat for them.
And also they got to experience some things that they had not seen or tasted before as well. Yeah.
In your opinion, can you just tell us 1 to 2 ways that the pandemic has changed how students are experiencing education at your schools?
Well, I would say the majority of our students have experienced some type of learning loss over this time. So I know at our school, being a Title I school, many of our kids are playing catch up right now. So we are, we're doing a lot of remediating, lots of opportunities for extended learning opportunities, Saturday school, after school programs that have a huge academic piece as well. So they are experiencing a lot more school at this time, because of that learning rush. We're trying to make it up. So a lot of them are a little restless, but hopefully they understand, or their parents understand how important it is and what we're trying to do to make up for those losses as best we can.
I agree completely. The learning loss was detrimental. One of the things that we experienced, and Yolanda, I don't know if you experienced it well, especially with the mathematics. The mathematics is something that you have to be there to teach the students. Learning mathematics through Zoom it didn't hit the nail on the head. Yes. So we're experiencing a lot of our students have a lot of regression in the mathematics. The science is another one, because science requires being there, having those hands-on experiences and things of that nature. So that was one of the biggest challenges throughout the Zoom teaching. And now having them back is just making sure that we focus their attention on instruction, because being on Zoom, you had so many other things going on that now being in the classroom and the teacher is front and center, getting the kids to focus on that instruction, the teachers have to put on their classroom performance hats.
For sure.
Both of you, I have to thank you so much for helping us kick off the panel and for your partnership over the years. Oh my goodness, close to 12 now. Yeah. We appreciate your leadership. We want to thank you for your commitment to public education, your students and families in South Florida. And once again, Ms. Maytine Murray, thank you. Thank you so much for all you've done for us. We're cheering for you, and congratulations on your upcoming retirement.
Thank you. And I want to say, thank you. And I want to say thank you to Common Threads, because it is a program that is so valuable for our boys and girls. I hope that we get to a point where we can have it in every one of our schools, because it's an experience that every child should be able to go through.
Thank you.
I agree.
So, it's a pleasure. So great to see you both. So before we transition to our next set of panelists, I'd like to share some information, some background to ground us on how the pandemic has really impacted our communities, especially in South Florida. So today we're going to highlight the difference between food insecurity and nutrition equity. Too often when we talk about hunger, we speak to this idea of feeding people, not necessarily nourishing our communities, and doing so in a really culturally relevant manner. This is really important because Miami is a very diverse community. Today, we're going to talk about what it means to eat well and provide access to food in a dignified manner consistently. And we're going to consider a new healthcare, one that's more preventative and focuses on wellness, because children with overweight and obesity are more likely to become adults with overweight and obesity. And health really starts at the home, at the dinner table. What children eat matters just as much as access to healthcare. So, social determinants of health. In a world where zip codes matter and determine the quality of life outcomes, supporting health and wellness of a community should be a foundational investment that's a concern to all of us. It's part of community development work. Getting in front of those health challenges to address disparities require multiple sectors to collaborate. Each certainly has a stake in bridging those gaps. Nutrition is a social determinant of health. Access to healthy foods matter. Those who report very easy access to fresh fruits and vegetables have higher rates have higher rates of eating more than 5 fruits and vegetables a day, report better overall health, and have a lower prevalence of obesity and diabetes. Common Threads has been providing hands-on cooking and nutrition education programming for 18 years now, and external evaluations show over and over again that that when experiential cooking is paired with nutrition education, we see statistically significant increases in vegetable consumption, vegetable liking, and frequency of home-cooked meals. So now we are more than a year and a half into the unprecedented COVID-19 pandemic, and we're starting to see how this is really impacting our health. Many people have recognized that weight gain was brought on during COVID as a result of stress and anxiety and reduced physical activity, but we're now starting to see the data that shows how this has impacted our children. These are some of the alarming stats that were just published recently last month in NPR, showing greater weight gain during the pandemic in children in all 3 categories: children with healthy weight, children with moderate obesity, and children with severe obesity. As a nation, we do not look good from a cardiometabolic perspective, and that includes children and adults. What we eat is certainly part of the problem. We eat much less of the recommended fruits and vegetables and more saturated fat, added sugar, and sodium. COVID has certainly made it clear that 40% of Americans do not have $400 in the bank in case of an emergency. A recent study from United Way Miami of families living near or below the poverty line tells us some of the sacrifices Miami families have had to make as a result of COVID. Low-income minority individuals have certainly bared the brunt of the pandemic, enduring the stress and anxiety of needing to make ends meet. Taking care of their health, unfortunately, became a low priority. We're now going to shift to the conversation about nutrition equity to policy making and regional feeding programs by talking with our esteemed panelists. Paco Velez, CEO of Feeding South Florida, Senator Rene Garcia, Miami-Dade County Commissioner, District 13, Senator Ana Maria Rodriguez, District 39, and Representative Vansalupis, District 115. Thank you all for being here with us today. So I'm going to start the panel off with my first question is for you, Paco, my friend. Your organization and the Feeding South Florida network of 300 nonprofit partner agencies were responsible for distributing 175 million pounds of food into 2020, 175 million pounds of food. I know from some of our colleagues and friends at other food banks that because of an influx in donations, it meant buying food sometimes for the very first time and switching from feeding people to actually nourishing people. Can you talk about some of the ways that you would say your organization has changed its practices as a result of COVID? Who are you on mute?
Sorry, should know by now. Thank you for having us on the. It's good to see. It's good to see friends of Feeding South Florida up on the screen. I just saw Representative Alupas a little while ago, or a few days ago. So great to see you again, Representative. Where we were going as an organization is where we're going now, and that's really what you touched on earlier. It's really providing access to food in a way that fits three criteria. One, it's culturally appropriate for families, especially here in South Florida, where we're extremely diverse. Two, it provides for, and it's dignified in a dignified and respectful way. Second, it works with medical restrictions. Folks that maybe have allergies or have chronic illness that can't have certain foods. We want to be sensitive to those medical restrictions and religious restrictions. Again, we're in South Florida where there are a lot of different denominations and religions, and we want to be sensitive to folks that may not be able to eat anything other than halal or kosher or can't eat certain foods because of their religion. So it's about choice. And so we successfully converted a lot of our partner agencies into choice pantries, even the ones here in our facility are choice pantries, where families can come in, choose what they want to eat, choose what they're going to serve their kids, and take it home with them. The pandemic actually switched it to where it was more of a distribution system where folks really did not have much of a choice. But we did bring in a lot of healthy items. Actually, more than 80% of what we bring in are foods to encourage, and those are healthy foods that fit the My Plate guidelines or fit the nutritional guidelines that the USDA has put out. We have since stepped away from most of our mass distributions where we're just saying, here's what you're going to eat. We are now into a situation where we're going back to choice pantries where families are able to choose what they want to eat. We're doing that not only with our partner agencies. I'm happy that you had the school district on because we do have school pantries. And the amazing thing about our research with school pantries is the intervention has created a few different outcomes. It's increased performance, increased attendance, and help behavior for our students. But one of the things that we did not anticipate that was positive was families have become more interested and engaged in their child's education than they were prior to having that school pantry intervention. So it's been a great program for schools and for our children and their families. So the pandemic has caused us for a short bit to get into the mass distribution business, but I think we have since gone back to where we wanted to go. One of the things that we've accelerated is our home delivery program. What the pandemic did do was highlight the fact that a lot of folks don't have transportation, or the folks have to stay home with their children. As a matter of fact, down in the I think it was the park, I'm not sure it was Tropical Park or one of the parks where Representative Alupas was, folks showed up in buses and some of the representatives had to drive the older adult back. I think he was close to 100 years old, if I'm not mistaken. And he had to go down and get some food because he didn't have any transportation. So our friends at the state legislature drove him home to make sure he got home safely. But that's one of the things. So we started a home delivery program thanks to the state legislator who funded this home delivery program for older adults and for folks that are really homebound and can't really get out.
Thank you so much. Senator Garcia and Senator Rodriguez, before I ask you this next question, first and foremost, Senator Garcia, I just want to thank you for your recent contribution to support our programs. We're really excited to be expanding in your district. And Senator Rodriguez, we are so grateful that you will be sponsoring our appropriation this year along with Representative Alupis. It means the world to us. So Senator Garcia and Senator Rodriguez, you both have a track record of advocating for quality healthcare for all, especially for families with fewer resources. We know some of the healthcare costs are largely driven by patients, including children, who are managing diseases that are heavily influenced by diet and limited exercise. We also know that low-income minority families have shouldered the brunt of the pandemic, and that pressure and stress to make ends meet has really made taking care of their health a low priority. Would you please share your perspectives on the importance of nutrition equity and its direct impact on health outcomes? Ladies first.
Yeah, I'll give the floor to the real senator.
Oh, you're the real senator too. Don't kid yourself.
Yeah.
So yeah, no, I think, a lot of what you just said with regards to, where does it all begin, right? So, if we could do something, to help people, get access to nutritional food and whether it's through Feeding South Florida or, at school where, where the children spend most of their day or other means, that's really where you control the root of the problem. Many of the diseases like diabetes, hypertension, so forth, all start with what you put in your mouth, right? So if you're not eating, a healthy meal, at least one, hopefully 2 healthy meals per day, you start seeing, these types of diseases, go up in numbers, it starts exacerbating. And then that's where you start seeing, the entry into the healthcare system, as Senator Garcia knows, because he works in healthcare as well. And I worked many years in healthcare. The most expensive entry point into the healthcare system is the emergency room. Because once you start having very, acute symptoms, and start feeling very, very ill, that's where it gets expensive. So the earlier we start, helping people with, having access to the right types of food, the right types of nutrition, it's like that saying, a stitch in time saves 9. So investing on the front end of the nutritional, from a legislative perspective, I'm speaking primarily, we invest in healthy nutritional programs, healthy things like common threads. That is what will help keep people healthy and keep the cost of healthcare down significantly.
Okay, and I first of all, it's a pleasure to be here with all of you, and it's great to be with such good friends. And I've worked with most of you here in the past, and it really is humbling to be here with you all. And the good thing, and I think one of the things that we discovered during the pandemic is that we've always talked about the inequities that exist in healthcare, right? The disparities, the healthcare disparities that exist, and that was more. It was brought to the forefront during this pandemic because now we can't hide from it. Now we know it exists, and more so when we look at the inequities in nutrition. We talk about, trying to figure out how we are going to make it more equitable for our families, especially our low-income families. And thank God for programs like Feeding South Florida and PACO, who really stepped up to the plate during this time, because for those of us that try to hide behind it, it really doesn't exist. It's just a term that is used. Well, the pandemic showed that it's real. And when we saw the lines that were happening, not only here in Hialeah, but all over the county, here in Dade and Broward County, and it was Feeding South Florida who was stepping up to the plate and making sure that these people were fed. No one's going to sit in line for 45 minutes if they don't need it. No one's going to sit in line for 45 minutes to get some milk or some protein and some vegetables if they really don't need it. Because some folks are saying, well, do they really need it? Well, let me ask you this. Will you sit in line if you don't need something? So I'll tell you the good thing. The one good positive that has come out of the pandemic is that, and now it's time for us policymakers to really enact policies that really are going to make a difference. And the way that we do that is, you're right, we talk about the issues of health education. It's not just about health education. It's about incorporating it in whatever sector of life we are in. One of the things that I was working on when I was in the legislature was when we look at nutrition programs. We have nutrition programs and nutrition educational programs, both through the Department of Education. We have them at Department of Elder Affairs. We have them through the Department of Health, and we even have them through the Department of Agriculture. We have all these different programs, but yet they're never talking to each other. There's no continuum of of education as it relates to what one program is doing or what the other program was doing. It's all working in silos, and that's one of the things that we need to start eliminating and try to break down is all these silos that exist in the field of nutrition education. So I think if we can get in different departments to start working together and working with the providers that are out there and try to bring up these nutrition educational programs like what Common Threads is doing, and invest some money into these programs to make sure that our students understand the importance of going out there and physical activity. Yeah, that's all important, but it's what you put in your mouth that makes all the difference in the world. And making it fun for these students to understand that it is fun to cook these different vegetables, fruits and vegetables, and incorporate the grandparents, the parents, aunts and uncles into the delivery of food, and how to cook food. So I think there's a lot of things that we can do both at the state and at the local level to make an impact in students' lives.
Thank you. I really appreciate your enthusiasm. In addition to your role as a representative of Lupus, you are the CEO of the Children's Movement, and you previously oversaw Volunteer Florida. That's the state's AmeriCorps program. You are deeply invested in early childhood education. A pediatrician friend of mine often talks about seeing patients in preschool with hypertension, and has now even seen a few cases of young teens that having bariatric surgery. Education is certainly the most effective intervention for leveling the health playing field. In your opinion, what types of policies do you believe are needed to further incentivize nutrition education in the schools? And perhaps you can also talk about other important programming for early childhood education.
Absolutely, Linda, it's so good to see you. And before I answer the question, I just want to celebrate you because your vision for Common Threads is honestly, it's nothing short of remarkable. And you and I have known each other for a number of years now. I've had the chance to go to some of your really exciting galas here in Miami. But whenever an obstacle is put in your way, you always get over it. And I just have to, as I said, celebrate you because what you've done here in Florida in pursuit of expanding the program across the state is truly remarkable. And to my friend Paco, it was great seeing you last week. I hope people understand, because I think they do. Senator Garcia talked about this. What Feeding South Florida did for our community during the pandemic was nothing short of incredible. Senator Garcia talked about waiting in line for 45 minutes for something. When we were holding food drives twice a week, and when we would get there in the morning to set up, we would talk to the police who were helping, and we would be told that there were people who were waiting from 10 o'clock the night before. So it really it's illustrative of the need that we saw in our community. And to Senator Garcia's point, for all of us in elective office, it should paint a very clear picture of how important these issues are. As it relates to early childhood education, Linda, that's the most important issue to me. I think it's sort of twofold, right? So in Florida, we have the CCFP, the Child Care Food Program, which provides breakfast, lunch, and a snack to children in subsidized childcare. And I believe the threshold is if your center has 25% of your children are subsidized, then you can apply for a CCFP. And making sure that those meals are healthy, really addressing the need of today. I think that is something that cannot be lost, and that's something that we've seen in our early childhood system. And a lot of times when I travel the state and visit early childhood centers, that's a conversation we have about how are they interacting with CCFP, which provider are they using, making sure that those foods are healthy. A lot of them are locally sourced. But it's also the question of how we're preparing students, not just for today, but for tomorrow. And actually, Florida has some fairly innovative programs. One is, I think it's called Florida Farm to Preschools, which is teaching young children about the importance of gardening, the importance of food preparation, in certain instances, doing tours of farms, and really, it's that educational component. So it's not just about the healthy meal in front of them. It's about helping to prepare them for being able to cook that healthy food at home, and really setting a framework for ensuring that children are eating healthy foods from a very early age. Because as everyone knows, you establish those strong foundations at an early age, and that's the momentum that carries them through their life. And to your point, Linda, it is terrifying that we're seeing these health impacts at younger and younger ages. And as Senator Garcia knows, he's been in the process a lot longer than us. He still looks a lot better than us, which is odd, sort of like Benjamin Button. But at the end of the day, there are a lot of great programs in Florida, whether you're talking about food insecurity or literacy, but a lot of times they're housed in different agencies, and there isn't the interconnectivity that you need to ensure that the programs are operating in a way that ensures the best outcomes for students. So I think that's a responsibility for us as legislators to make sure that we are, that our intentions are good, but that they're also resulting in proper implementation and that students are being well served. And again, I'm really excited, Linda, this year to carry your appropriation, because I know I've seen your program. I've seen what it means for the students who get to participate. And those students are incredibly lucky to be able to participate in your program. But we don't want this to be a program for only lucky students. We want this to be available for as many students as possible. And I know that Senator Rodriguez, my former colleague from the House, she left us. She's big time now, but she gets to hang out at the beach during the day. That's what senators get to do. But that's something that I would love to see the state continue to really invest in and make that something that we see for the years to come.
Thank you so much, Vance. I have to share with everyone that I think our students really taught you a skill or two, some knife skills in the kitchen. That was really fun. I think we made a Senegalese curry that day. So I think we touched on this just a little bit. Senator Garcia talked a little bit about collaborations, but I'd like to dig a little deeper. Forgive my wording, Paco, but I'd love to talk about what needs to be done, not only to feed people today, tomorrow, but for a lifetime. So if you would all think about perhaps some of the changes and maybe additional collaborations that weren't mentioned earlier, I'd appreciate it.
So happy to share. And it's interesting you use that terminology. That's the Feeding America works on food for today, food for tomorrow, and food for forever. And so as a network and as an organization, one of the things that we're working on, or a few things we're working on, is not only the food for today, which means that we're providing access to healthy food, nutritious food for families in its raw form, as well as in its prepared form, as we're preparing medically tailored meals out of our kitchen and shooting those out to families. And as Senator Rodriguez mentioned, that folks that are dealing with chronic illness, whether it's diabetes, COPD, or any other issues, we want to make sure that we're providing the right nutrition for whatever ails them, and hopefully moving them into a more healthy state. The other piece we're doing is we're providing life skills training for individuals that come to our pantry. And that life skills includes computer literacy, financial literacy, and basic interview and resume building skills. We're not only trying to help them with food, but we're trying to help them with some of the soft skills that a lot of the employers are looking for in order to retain employment. The big thing that we're working on now, and this is also thanks to the legislature, is our workforce training program. We're using our assets not only to serve our community, but we're using our assets to now train our community. We have a culinary training program that is teaching folks the basic skills in the kitchen, food service industry, from knife skills all the way to desserts, as well as troubleshooting equipment, which is a huge asset in any kitchen. But we're also teaching those soft skills, how to not only attain jobs, but how to retain those same jobs. And we're working with a lot of our restaurant partners in order to place all our graduates into those positions. Same time, we also have a warehouse training program since we do have a large warehouse and equipment. Our warehouse training program is training individuals in inventory, receiving, picking, selecting, shipping, every aspect of the warehouse industry, and have a great partnership with Publix and with the Ryder and CNS that they promise to interview every single graduate from our program and have placed every single graduate in our program into much higher paying jobs. These jobs pay at minimum $15 an hour, so it's higher than the living wage that's been established, as well as providing them those soft skills in order to retain those positions and hopefully continue to grow. So it really is about breaking that cycle, and I like that little cycle that you shared earlier in the presentation. We have a similar cycle where food affects education, if education affects the ability to get better paying jobs and overall health, and then the cycle continues and just continues to move around. So that's where we're trying to break that cycle, is to provide a higher paying job so folks can help feed their families better and some healthier food.
Thank you.
Linda, I'll jump in. I think one of the things that we're seeing, and this is really around innovation, is looking at it from a two-generational approach, right? So understanding that you have to serve the needs of and I'm talking through the lens of early childhood. You have to serve the needs of the child, but you can also serve the needs of the family. And sometimes almost all the time, it's critical to address both. So, we have seen, I'll give an example in Broward County, Jack and Jill Child Care Center. They actually have a food pantry in the child care center to support the parents and the families of the children who are in the center. So, looking at it from that two-generational approach, I think is going to be important, not only from, as you said, the needs of today, but also the needs of tomorrow. So how are we incorporating the parents and the educational components that the students are getting? One of the things, just in preparation for today, one of the things that I was really encouraged by is to see that the state has provided flexibility to child care centers who are participating in CCFP to actually use those dollars. Obviously, they have to provide the food to the children, but to have flexibility to use those dollars to either purchase locally sourced food or to implement programs like the Flora Farm to Preschool, so that they can actually have gardening programs and things like that. So again, I think giving flexibility to some of these childcare centers, you're going to have extremely innovative ideas come out of it. And a lot of times it's going to be hugely beneficial to the children and their families.
Thank you.
Another thing that can be done, one of the things that I've been working on, as well as with our health plans. A lot of the children that we know are insured through KidCare here in the state of Florida, and a lot of their parents are insured. These parents that are on Medicaid, they're insured through Medicaid programs, Medicaid HMOs. It's trying to work in collaboration with the health plans as well, and put them in, make sure that there's programs in place where they do have nutritional programs that can help, connect the child and the family to good nutritional programs across the community. Those are the programs that we need, the things that I've been working on and making sure we try to connect these dots. I know that's like certain plans like at Aetna and through CVS, I've been ensuring that they have, trying to address the issue of the food deserts in communities across the country. And they teamed up with Feeding South Florida, Feeding Florida, but not Feeding South Florida. What's the national company, Paco? Feeding America. What is it?
Feeding America, yeah.
Feeding America. And it's not because it's here, but those are those partnerships that really are long lasting, that aren't just, when we talk about the multi-generational, that's exactly what we need to be doing, because it goes back to what we were talking about earlier, what I was talking about earlier, the partnerships that can really exist, that you go into the schools, go into the senior centers, go into the community centers, and making sure that we connect all these dots, because that's the only way we are going to start changing those trends and trying to change those food deserts that exist in our communities, and empowering families to understand that they do have options. It's not just going to a McDonald's or Burger King, not to demean them, but you know what? Fast food is fast food. And that should not just be the only option that they have. And that's why these programs, when you bring these programs and you bring them into our communities and partner up with even local grocers, where we can provide food, provide fresh fruits and vegetables. And then when a kid goes to a school program with Common Threads, and they go to a grocery, they see green peppers and they see yellow peppers. They know what they get that instead of getting something else. They bring it home and start cooking with the grandparents or the parents, and that's how you start building, that cycle, breaking that cycle of the food insecurities, and start building new and lasting generation trends that could be life changing.
Thank you, Senator. Senator Rodriguez, did you want to weigh in on this one as well?
Sure, I'll go ahead and chime in. I think one of the other things as well, and it's not so much, from a legislative perspective, but more of like, there's this kind of not a stigma, but like some people see cooking as a chore instead of like something relaxing or something to bring the family together. And I think if there's more of a focus on the benefits of cooking together and spending time together, and not seeing it so much as a chore, but rather a form of therapy or a form of just, teaching, like a teachable moment, showing your kids how to make a recipe or do something like that. It could be seen not only from the nutritional perspective, but also from the, kind of like spending time together and doing something productive together. And that's also very important. And I think there needs to be more focus on that as well.
Thank you. This is for all of you too. So we at Common Threads, we know that nutrition, education, and cooking as a standalone effort is not going to solve the larger systems, food security and nutrition equity issues, especially given the impact of food marketing. Senator Garcia, you just talked to that a little bit about food swamps. Packaging trends towards overly processed food and oversized portions. We know that public policy and advocacy is the key to real change. Vance, you talked about CACFP. So in your opinion, besides some of the major federal relief efforts like SNAP, what are the ways families in South Florida can advocate for local change that really does impact their nutrition and health?
I'll just jump in, Linda, before you call on one of us. Again, I think a lot of it is just, it's so difficult, right? Because as Senator Rodriguez said, it's just so easy to eat unhealthy. It really is. And especially, if there is a silver lining to COVID, and I'm sure if we think about it, there are some, but it really forced us to stay in our homes and be with our family and slow down for a minute. But we're all living life as fast as it's ever been lived. And, you try and, if you can save 15 minutes here or 20 minutes here, you're going to do that. And a lot of times, the net result of that is you're eating something that you probably shouldn't be eating. And I'm the first to admit to that. I'm not like Senator Garcia, who publicly shames people for not exercising. I'm trying to get on it, Senator Garcia, maybe next week. But I think just when I was listening to Senator Garcia speak, it reminded me that so many of these issues are interconnected, right? And I think one of the things, again, going back to my original point, it's fine for the legislature or the county commission or municipalities to create programs. I think that's fine. And again, I think they're all well intended. But if we're not doing as equally an effective job as connecting those programs and connecting families to those programs, then we're doing a disservice to our community. And I'll give you an example. We launched a program in Florida, and Senator Garcia was very helpful in this, probably 7 or 8 years ago, called Help Me Grow, which was a universal central phone line that parents could call to get information about early education and childcare in their community. Now that is provided now through CCR&R that the ALCs do. But what was different about Help Me Grow is that they had a live person on the phone who would actually talk with the parent, because a lot of times what they were finding out is that if a parent was calling about a question regarding childcare, there might also be a housing issue. There might also be a food insecurity issue. There might also be a developmental disabilities issue. So all of these programs are all now being housed and connected to an individual through one central location. And I think there has to be work done, as I said, to coordinate all of these resources. Because again, as I said, if you're experiencing food insecurity, there's a high likelihood that there's some other challenge that you're experiencing, and they're fully interconnected. And it's our responsibility, if we're trying to give people that foundation to get back on their feet, to make sure that we're doing it in as efficient and effective way as possible.
Thank you, Representative Alupis. So before we move on to the last question, at least my last question, I want to thank everyone for being here. We're going to be chatting out an exit survey in the chat so you can share your feedback and additional questions from today's panel. Please feel free to put all of your questions in the chat. I also just want to give a quick shout out today. We have people from all over the country, but want to give a special out to the 10 students from Howard University that have made time and space for this conversation. We're really glad that you made it. I thought my last question, I'd love to hear what's on the horizon for each of you as you continue to do all of the very meaningful public service work for South Floridians. Can you each tell us, what legislative bill, program, or partnership that you're currently working on to either promote greater access to healthy food, better access to healthcare, or more investments in early childhood education with that whole child approach?
I'll chime in since Vince took it the first time last time, so I'll do it. One of the things, the difference between the legislature and the county government is that when you, county government, when you enact an ordinance, a resolution, it kind of goes into effect right now. So you see the fruits very quickly. And one of the things that we just recently passed, and something that I've been fighting for, to increase healthcare for the residents of the state of Florida, has been through the Medicaid program. And unfortunately, a couple of years back, when we were in the legislature, we were trying to expand Medicaid. I know that could be a bad word for some folks, but I thought it was the right thing to do. Make sure I try to grab those federal dollars and make sure we put it back into the economy. I think it works both on the social front and not on the economic front to expand healthcare services for our community here in Florida. But recently here in Miami-Dade County, we did it pretty quietly. Actually, we set up a program. Here in Florida, the way that healthcare hospitals are funded, through the most part, is through a low-income pool program, which uses tax dollars that are brought up from the local governments and local taxing districts to tap into the federal dollars and bring it back down. Well, was only good for our public hospitals for the most part, but we did set up a program down here in Miami-Dade County called the Direct Payment Program, which now our private hospitals will be able to tap into some of those federal dollars to expand healthcare services here in Miami-Dade County. And that's kind of a pilot program that we're doing. And I think it's going to work because those dollars are going to go right back into the community, right back into these hospitals to start delivering and expanding on the services that they offer for the residents in those local communities. So I think I'm really excited. I'm really excited about that program. And also what I've been working with is with different childcare providers here in our community, in our community here in the district. I'm not saying Dade County wide, and with Common Threads, try to link, again, going back to the linkage, right? Because if we don't start linking people and combining our programs and trying to, not duplicate our efforts, then that'll go all to waste. So it's a matter of bringing people together and having these organizations working and talking to each other to make sure that we do have a robust system in place. And through education is the way you're going to fix these food insecurities that exist in our community, in big part, is through the education system and making sure that we are not only in our Miami-Dade County public schools, but also in the Hialeah program, in the Hialeah Park program, and in the senior centers. And those are the things that we're going to continue to do through our district funds and District 13. We're continuously working. This is why you see the funds that were allocated from our office to your organization, and we're going to continue to do that to make sure we keep on growing those programs, and that's the way to get it done, I think.
I couldn't agree more. One of the things that I love so much about working in Miami is just that collaboration. Our organization was really built on the social ecological model to make sure that our programs are everywhere where children and families live, learn, work, and play. And in addition to being in the schools and community-based organizations, we are in the parks. We train up FIU dietetic interns to become champions of health and deploy them into the parks. We're excited to try to bring one of the pilots that we did in Chicago, where we train up medical school students through a culinary medicine class and then deploy them into the schools. So again, building that pipeline of wellness warriors is just so important. So I really appreciate your comment. Would anyone else like to answer?
I would say the two things that I would love for folks here. So I think, again, going back to early childhood, our early childhood system, our early childhood industry is in real, has real challenges right now coming out of the pandemic. We cannot find individuals to teach in our classrooms. We have centers closing, and I think people are just now beginning to understand that childcare is really the backbone of our workforce, that without a robust childcare industry, the economy cannot thrive. People cannot go back to work. And I know our chamber is really looking at issues to ensure that centers across the state can get back to pre-pandemic levels and provide quality care to every child in the state. That is, I think, the most important issue to me. On the food insecurity issue, one of the bills that I'm running this year, still looking for a Senate sponsor, but we'll find one, is there are certain populations of formerly incarcerated individuals who are not eligible for SNAP. And for some reason in Florida, we still have populations that are not eligible for SNAP. So coming out of prison, trying to reintegrate into society, and making sure that they have the necessary benefits to get back on their feet. So that's one of the things that I'm looking to do this year, is to make sure that those SNAP benefits are available.
Excellent.
Well, Representative Alupis, if you need a Senate sponsor, I volunteer to be your Senate sponsor.
You would.
So we have some questions from the audience.
Well, Linda, real quick, I want to.
Sorry.
Oh, sorry. No, sorry. I'm glad you pointed out the folks from Howard University. We are actually working with Ryder and Howard University on a pilot project where we're going to better understand the families that we serve. So a huge thank you to the folks at Howard for all their efforts and what they're doing to help us better understand the families, the households, who's in the households, how we can better work with families to get them out of food insecurity and into self-sufficiency or self-reliance. Along the same lines of being more healthy and going to parks and food deserts, our mobile pharmacy, FARM, is doing that, going out to these food deserts and providing a one-aisle grocery store so families can access those fresh fruits and vegetables from the store. Some of them are for the SNAP benefits side on the grocery store side, and some of it is distribution to low-income families and on the free side. But those are some of the things that we're trying to do to help increase nutrition education. And looking at figuring out how we work with common threads and say, we're already at the schools, you're at the schools, how do we work together to provide the food, provide the nutrition education, so we can marry those two things and do kind of what Senator Garcia is talking about is how do we work with those folks that are already in the community doing certain things so we can kind of handle our core competency and those other folks can handle their core competency and really make a true impact in our community.
Thanks, Paco. Senator Rodriguez, I know that you do a lot of work in affordable housing. One of the pilots that we just started working on actually in Chicago again is providing our programs for individuals living in mixed income housing. I'm just curious to hear a little bit about any of the projects that you happen to be working on there to build more equitable communities.
So one of the projects that I've been working on over the last couple of years because as you know, I also work with the Miami Association of Realtors. And that project, which we just finished recently, is turning a shipping container into a living quarter. And I know it's not a new concept in other parts of the country, but I know in South Florida, we don't really see shipping container homes as much as probably California or Colorado and Utah. But we're trying to start a trend down here to help people access affordable housing. And we actually got a parcel donated to us from Miami-Dade County, which, it was what's called, and it's like an irregular lot. It's a very small lot. We put the 2 shipping containers together, and, again, we're trying to just show people the feasibility of this type of housing, for people who cannot afford anything bigger than that, but who don't necessarily want more space. So, I know that this hopefully will catch on. We've gotten a lot of inquiries about it, a lot of interest in this type of housing, and hopefully it'll take off. So,
thank you. We have a question from Robert, who is actually the Director of Health Strategies at the American Heart Association in Miami, and he asks specifically, what industries do we need focusing on our joint efforts so we can create sustainable impact?
I'm happy to try to answer that. So I think one of the industries that we need to focus on keeping here locally is agriculture. I actually live in Homestead, and I'm very happy. I moved there about a year ago, but there's definitely an assault on agriculture, and obviously there's only so much land that we can build on. So I see a lot of developers and people wanting to move the urban development boundary, and which will obviously make our agriculture access much more limited. I think the fact that the prices of our food, particularly our produce, have remained somewhat stable is because we have a lot of it sourced here locally. And I think we need to try to fight to make sure that agriculture remains a part of our local economy. And as a result, we'll keep our prices down for the produce, and that's what I think.
I think we need every industry involved as much as possible. I mean, food insecurity is one symptom of something bigger. It doesn't exist in isolation. You have housing, you have education, you have really almost every industry that's impacted by poverty or inequity, and we need to bring those folks in and really figure out a coordinated effort. And to Senator Garcia's point, a coordinated effort that's going to be efficient and a good use of everybody's resources. One thing I do want to touch on that Senator Rodriguez mentioned is, yes, we do have an issue with our agriculture land, especially Palm Beach County and Miami-Dade County, now even Broward County, where all of it is going to development, or a lot of it is going to development. And not only does it present an issue for our workers here and low-cost produce, but ultimately that could present an issue for overall national security, as we start to rely more and more on foreign food. That's gonna actually make us reliant on a foreign power. So we have to be very careful of what we do with our agricultural land.
And Linda, I would just echo what Paco and Ana Maria said. I just think we also have to, from a communication standpoint, we just have to go to where families are, right? I think it has to be more than putting together a nice one pager and emailing it out, hoping that effectively communicates the programs that are available. So if you know that a program is heavily, a childcare program is heavily subsidized and there may be need, communicating to families through the childcare system, through the school system, obviously engaging media, the healthcare industry, all of these locations where individuals, by just the nature of life, are going to be congregating and coming together. making sure that those are our partners and making sure that we're pushing out the information and the programs that are available.
Thank you. I have another question. Okay, for the policy leaders, can we take the lessons learned about the fight against big tobacco in terms of marketing and promotion that succeeded in reducing the number of young smokers to implement similar approaches in relation to food? I'm thinking the whole seatbelt campaign too. What are the challenges and opportunities here? Would you support these type of policies? Why or why not?
I think it's important. That's a loaded one. It's a really loaded question, and how we address it. I think the first step is what we're doing now is through education. I think that's the way that you're going to start changing habits, and addressing the issues that we already know exist, especially as it relates to the food deserts that you see them in our own backyard. We have to do a better job at bringing, nutritional food to these grocery stores, making sure that the students know the importance of, like we talked about earlier. I think if we start going down that path, one of the things that we've done, in a lot of states across the country is making sure that people know the calorie counts as to the foods that they're eating. I think that has gone a long way to start changing eating habits. I, for one, I've been more cognizant of it. Every time I go to one of these, go to a restaurant and so forth, and you see these calorie counts on there, instead of getting the higher calorie count, you maybe you pick something else. I think those little policy changes can go a long way, and allowing people to make their own decision, determine the path that they want to go down. If we start going down the path, we've seen the battles in Tallahassee as to the sugary drinks, as it relates to, maybe people that on SNAP programs should not be able to have access to Coke or other sugary drinks, I guess. Then you start, you start downplaying or criminalizing, I guess, poverty in itself. People should have the right to determine what choices they make. But I think it's important for us as policymakers to educate and make sure that we give them all the tools available so they can make the right decisions for them and their families. But it is an interesting policy debate. It is an interesting question to ask and to pose out there, because you can get so many different answers as it relates to that. But I think for one, I will tend more to be the policymaker to push more on the education side.
I mean, I'll piggyback on what Senator Garcia said. I think, the calorie count piece. I think, again, a lot of it is about education, and a lot of it is about choice. But I think the important point that he made is that sometimes individuals don't have choice. And I think one of the concerns that I have, if you've been to the grocery store lately, the cost of food is increasing at a substantial level. So whether it's protein, it's milk, things that would be a staple in a healthy diet, my fear is that people just for purely economic reasons might be deviating away from what might be best for their own individual health. So again, a very interesting question, and I do believe that at the end of the day, to your point, Linda, it goes back to the mission of your organization. You have to educate people. You have to get to them before they're in the drive-thru at Taco Bell looking at, do I get the 800 calorie, quesarito, or do I get the 600 calorie taco? And then saying, I got the taco, so therefore it's good. It's about education, and it's about educating individuals before they're in a position to actually make that decision, just looking at the calorie count on the menu.
Makes sense. This was a really interesting question that I thought is important to bring up, and this will be our closing question. Similar to mental health and stigma, what steps have been taken to overcome the stigma associated with food insecurity, or what steps need to be taken?
Well, what steps need to be taken to combat the food insecurity?
the stigma associated with food insecurity.
No, but again, it goes back to, I think, maybe the previous question how it was asked. And we have to be careful that we don't criminalize or, poverty or these communities. I don't want to say marginalized, but these communities who have these food deserts and so forth. It's important that we go in and try to educate and lift communities up. And we lift communities up by giving them the resources, not by penalizing them because of their socioeconomic status. It's important that us as policymakers come together to address those issues, work with the non-for-profits. But one thing is, I think Representative Lopez was talking about it. One thing is, to speak about it, but the other thing is to act on it. And we have to start, acting on these great proposals that are coming through the legislature and making sure that we incorporate folks and get them into these communities. And it's almost like in healthcare and triage them, we have like a triage of certain communities and come in and not try to penalize them or criminalize them or talk down to them, but just try to lift up these communities. And you do that with showing them respect. And I think if we do that, we'll start making a big difference in our community.
I think it's using your voice also. I mean, this is one of the things that Representative Alupas talked about is when, and it was highlighted during the pandemic, is there were new folks that were coming through the line or coming to pantries that would never have access to a food pantry before. But when the kids are home, they couldn't go to school, the parents couldn't go to school, right? So this was this communication, this advocacy, this voice, making sure families know, not just families, that it's okay to ask for assistance, but also from the other side to educate the rest of the community to say, here's what our families are going through. Our families are struggling. They don't have the income based on our minimum wage and our cost of living in South Florida in order to live or to afford the basic nutritious items and a roof over their head. So I think it's just really communication. I think that was brought up in some sort of the smoking cessation or the seatbelt thing is how do we communicate all that and share food insecurity is unfortunately real and there's nothing to be ashamed about.
Thank you, Paco. And we want to take a moment to thank all of our panelists once again for joining us today, and a special thank you to our guests as well. For more information on Common Threads, please make sure to visit us at www.commonthreads.org and also check us out on social media. This has been a terrific discussion today, and we really appreciate everyone for being here. Have a wonderful day.